Our presenter for tonight, as you well know, he's a licensed caregiver, a social worker, and a psychiatric social worker in Japan. He's now an affiliate of GYMS Philippines, and he's also passionate to share about dementia care knowledge to the world. He's in Manila to teach the Japanese style of caregiving to Filipino care workers. And he also passed the Dementia Care Expert Examination Part 1 last December 2021. So let us all welcome Mr. Jack Junichi Fukui.
Thank you. Hi. Good evening, everybody. This is the last lesson of the part 1, but don't worry, we will continue. Next week, we start part 2. Okay, part 2. Then the past 2 lesson, I already taught you what is the dementia design care. I already taught you, but some of you, it's new, so that I want to quickly explain what is the dementia design care. Okay, let me share my slide.
見えます。
OK、見えますか？はい、ありがとうございます。OK、dementia design care. Dementia design care is makeup word which is combined with dementia care and design thinking. Okay, makeup words. Why I applied dementia design thinking on the dementia care? Because dementia care and design thinking can be overlapped into some important point. And with the approach of the design thinking, we can develop, I believe that we can develop the sense of dementia care. By the way, what is the design thinking? Okay, design thinking is a problem-solving approach that the designer applies on their work. Some of the world leaders like Apple or Google or Samsung or GE have rapidly adopted the design thinking approach. Okay, this is a kind of the trend in the business world. Okay, one of the features of design thinking is human-centered technique to solve the problem in a creative and innovative way. Okay, like this. Okay, like for example, how do you use the design thinking? Okay, she is, okay, let me, okay, she is designer. Okay, this is an example. And he is a target user. Okay, maybe he is elderly. Okay, then now she will solve his problem with design thinking approach. First of all, the designer will research the target user by interviewing, okay, or the visiting his surrounding, ask or specialist, something like this. Okay, then she put a lot of information about the target user into her head. This. Okay, after that, she will extract something indivisible or something important out of the information that we call insight. Insight, okay? And then create a solution for the target user, like a chair or a service or the design of the cell phone for the target user to live comfortably or what else, happily. Okay. Unlike the artist, designer create a product or service for the target user. The way designer thinking is how to solve the user's problem. Okay. Artist is to create a work or a product to express artist imagination or artist mind. On the other hand, designer is create a work or product or service for the target user. That is a big difference. Okay. Okay, this is another example. Okay. Target user asked the designer. He say, I'm trying to work for a long time. Okay. He can work, but he has difficulty to work for long distance. Okay. And then how the designer solve target user's problem? Like this. He is tired. Okay. When he walk along, why don't he sit on the chair and move? Then this is a solution with design thinking approach, because if we use the wheelchair, he can move without tiring, right? Okay, like this. And then next question, he said, the target user say, I want to have a drink at the bar. Look at this, bar. You know, of course, he can go to the bar with wheelchair, but the bar counter is so high. It is not comfortable for him with wheelchair to drink at the bar, right? Then how designer creates a way to solve the problem? Like this, standing wheelchair, okay? Standing wheelchair. He can move to the bar with wheelchair while sitting. Once he start to drink, wheelchair, transform to this position. Then he can drink while standing. See, this is the approach of design thinking. Okay, last question is this. I want to have a girlfriend. Target user asked the designer how he can find a girlfriend. Okay, do you have any solution? Maybe some of you already know, but let me ask. じゃあ、OK。じゃあ、ケントさん
はい、先生。
Okay. What is your solution if you are a designer?
I think that's a big problem, sensei.
Of course. So with the design thinking, so how do you solve his problem?
That's a hard question, sensei. I don't have the answer to the question.
No answer. Okay.
No answer for that.
That you need, study the design thinking. Okay. Anybody?
You borrow the phone to her.
Oh.
So that he can find a friend.
Good. That is one of the solution. Good idea. じゃあ、ジェーンさん、do you have any idea?
Yes.
You know the answer?
Not exactly, but
Okay.
I can approach because I'm a girl. Oh, I can be your friend. I can be your friend.
I see. If you are a designer, so you're gonna be his girlfriend.
Yes.
That is a perfect solution. Okay. Thank you very much. Okay. So my solution is like this. I create the, fashionable wheelchair. Okay, because ordinary wheelchair is very, old-fashioned. It is difficult to attract the lady. Okay, lady. But if the wheelchair like this, maybe somehow he can, attract the beautiful lady, because lady also interested in the riding on this kind of the wheelchair. See? So actually, this is no exact answer, but with your imagination, with your design thinking, we can, create the solution. Okay, design thinking again is a problem-solving approach. Okay, then next, what is a dementia? What is a dementia? Of course, everybody knows the dementia, right? Dementia, 認知症ですね。認知症。What is a dementia? Okay. Dementia, according to the textbook, dementia is chiefly defined by gradual and permanent memory loss. And it causes disability for people to read their usual life. Okay, actually, the dementia is not disease. Dementia is a disability in daily living. Okay, how it causes dementia? Okay, look at this. First of all, organic disturbance to the brain. Organic, I mean the damage to the brain. Okay, damage to the brain. Then some disability occurs. You know, we call the major symptom. Okay, core symptom. Major symptoms have to do with memory. Okay, core symptom, memory loss. Okay, it causes the learning disorder, disorientation, or executive function disorder. Okay, this is a core symptom. As a result, BPSD occurs. By the way, what is a BPSD? I already told you what is a BPSD. How about Miss Charlie? What is a BPSD?
Behavioral and
Yeah.
psychological
Yes.
symptoms, disorder.
Yes, good. Behavioral psychological symptom of foci for dementia. Okay, like a wandering or verbal aggression or like this, and the mental disorder or sleeping disorder and physical disorders and communication disorder. Actually, you know, there are the many kind of the disease. No, not the disease, the symptom occurred because of memory loss, because of the core symptom. Okay. I told you that the core symptoms are cannot recovered, you know, cannot treated by any treatment. Okay, core symptom. We cannot cure core symptom. However, BPSD, I mean the behavior and the psychological symptom of dementia, can be alleviated, sometimes cured completely, with proper care and response. Okay, that is very important. Again, the BPSD can be alleviated with proper care and response. Okay, dementia care is to, you know, to understand the core symptom and the BPSD properly, and we should understand the patient with dementia. Because, so I already explained, Mr. Murofushi, Dr. Murofushi, he is a pioneer, a Japanese pioneer of the dementia care. He said, look at this. Dementia care is defined as understanding the mind of the elderly with dementia and supporting them to live continually just as they have always lived. This is very important. The principle of care is to reduce anxiety in the elderly with dementia so that they can live in peace. Okay? So, look at this. Person understanding the patient is more important rather than understanding the disease. Then supporting their unusual life. Then I already explained like this. BPSD. There are the many kind of the BPSD, right? Many kind of BPSD. It's all depending on the type of the dementia or characteristic of the patient. Okay, depend. But in the old care culture, in the past, BPSD were considered as problematic behavior. But now, we consider, okay, we believe BPSD are consider as a message that the dementia patient used to convey his her need. As you know, it is difficult for the patient with dementia to express psychological problems and the symptoms they are suffering with, because look at this. One of the BPSD is communication disorder. It's hard to express, or mental disorder. So that's why the usually the dementia patient difficult to express how they feel. How should we know their need, right? That's why the design thinking, not dementia, design thinking, because design thinking is a problem-solving approach. Okay. Then also, the design thinking is a human-centered technique to solve the problem in a creative and innovative way. Actually, it is not only for the designer, but also for other people in the various fields, such as nursing field. Then I discovered it is also effective to apply the design thinking on nursing field, especially dementia care, because design thinking is, human-centered technique. Dementia care is person-centered care, right? And then designer needs to target user. We have patient with dementia, okay? We should solve patient problem, right? That's why I create dementia care combination, dementia care and design thinking, which is dementia design care. Yeah, is that clear? Please show your reaction. Good. Okay. So, okay. Now, let me make a breakout room. Let's discuss. How do you think about dementia design care? Please discuss. I give you the 10 minutes. Everybody can see?
Yes.
Okay, good. From the textbook, the Dementia Care Introduction, okay, the chapter, chapter 4, okay, the inner world of the elderly with dementia, okay. Dementia makes a person unable to articulate or express his her thought, worries, and feeling properly. How good is our understanding of the inner experience and turmoil of the elderly with dementia? Here is a brief sketch of a typical morning for Aaron, a patient with dementia. Okay, Mr. Aaron is a patient with dementia living in the nursing home. Okay, then now I read the article from the viewpoint from the caregiver, from the caregiver perspective. Okay, thank you. Okay, let me read. Let's say that he is Mr. Aaron. Okay, Aaron suffered from dementia. He was admitted into a residential care facility about 6 months ago, but is still having difficulty adapting to his new living arrangement. One morning, he leaves his room and begins to walk up and down the corridor slowly. A staff member at the facility greets him. "Good morning, Aaron. How are you feeling today?" Startled and unable to recognize the staff member, Aaron murmurs, "I'm well, thank you." because he is suffering from dementia. He doesn't recognize her. When she suggests that Aaron should have his breakfast, he replies, well, the trouble is that I have no money. The staff member replies, don't worry, Aaron. Your son, Ben, paid for all your expense here. Aaron cannot understand what is going on, so asks back, what? Did Ben already pay for my breakfast? But how? A staff member leads Aaron down to the cafeteria and serves him his breakfast. Aaron replied, sorry, but I don't have the money to pay for this. The staff member repeats again, don't worry, Aaron, your son Ben paid for it, so help yourself. Having eaten his breakfast, Aaron begins wandering around the building again. Aaron surprised the entire staff last week when he left the building all of a sudden without anyone noticing him. He disappeared, okay, last time. Ever since then, unknown to Aaron, one staff member has been following him everywhere he goes. Because if Aaron leave outside the building, it's dangerous, right? That's why the staff following him. Aaron occasionally looks back to see the employee following him around, but doesn't know how or why to stop wandering around. This is from the caregiver's perspective. Caregiver's perspective. Okay? Understand? The next, everybody can become Aaron. From Aaron's perspective. Okay? Please understand how different. Okay. Aaron wakes up one morning to find himself lying in a room he has never seen before. Where am I? What am I doing here? How on earth did I get here? He struggled in vain to remember. Unable to answer any of his questions, he gets out of bed and starts wandering around as he grows more restless. A row of similar-looking doors are lined up along both sides of the corridor. Behind one pen door, Aaron catches sight of an old man lying in his bed. There are younger people walking around him, all dressed in the same clothes. Am I in a hospital now? Aaron asks himself. A woman dressed in uniform approaches him and says, good morning, Aaron. How are you feeling today? Not recognizing her at all, Aaron meekly murmured, I'm well, thank you. Aaron is curious how the woman has come to know his name, just as he was about to ask her where he was. She cheerfully suggests that he should have his breakfast. This reminds Aaron of how hungry he is, but he also realized that he had no money to pay for a meal. So, mustered up his courage and confesses, well, the trouble is that I have no money. This seemed to irritate the woman a little, and she answered, don't worry, Aaron, your son, Ben, paid for all your expense here. Aaron is even more stunned, wondered how Ben, now in his 8th grade, could have paid for his father's breakfast. At any rate, because he is very hungry, he decided to try his luck at having a free breakfast. When he arrives at the spacious room resembling a cafeteria, he sees several old people gathered together around the table eating breakfast. Why are there so many old people here? Aaron wonders. Because Aaron didn't recognize where he is. Okay, the woman he met earlier brings him his breakfast, Not sure whether he can really have his meal. Aaron repeats, sorry, but I don't have the money to pay for this. The woman seemed even more irritated and retorts, don't worry, Aaron, your son Ben paid for it, so help yourself. Aaron is frightened and starts eating. All the while, he is thinking to himself, as soon as I finish this, I should get back home. I wondered if anyone had called me at work. What on earth is this place about? I should start looking for the way out as soon as I leave this room. As Aaron starts walking around in search of an exit, the woman keeps following him around. This worries Aaron further. This is creepy. Why is everyone stalking me? What do you think? Do you understand somehow the feeling of the patient with dementia? If you understand, please show your reaction. Okay. So totally different world that both people seeing, right? So we should imagine how patient with dementia feel or think. Okay, in this article, Mr. Aaron may be living in his maybe 40s. That's why he is worried about the call from the work. His son is 8, but in reality, maybe he is 80 or 70 or 80. That's why his son paid for all expense. In his mind, he is living in 40s. Okay? All right. じゃあ、next, I want all of you to use the miro to express how you feel. Okay? じゃあ、please go to the miro. Please use the sticky note, green sticky note. Like how the caregivers feel. Like she is irritated. Right? Irritated. She is maybe worried. That's why she followed him. Something like this. Hi. But first, please write your nickname here. Is that clear?
Do you have any questions?
Sorry, in my case, I didn't follow.
It's okay. So you use the cell phone, right?
Yeah, because it's too small and I lost once.
It's okay. Just see. You have a PC. So next time, please use the PC.
Yeah, so
because okay. So I want to emphasize that this is a class of dementia design care. Okay. I don't want to keep talking. I want to stimulate your right brain by using miro. Okay. While writing, please talk. Your talking stimulate the other people's brain.
Okay.
Please, mic on. Everybody talk. What is your
Okay.
nickname? What is your nickname? 待って、じゃあ、I give you the two minutes ね。2 minutes.
Okay, I'll just
Hi.
share my
Hi, thank you. Hi.
uneasy. Shift the nurse feel uneasy or uncomfortable, unsure.
あれ ?MJ さんあれジェーンさん、where are you?
私書いてないです。
書いてない。書いてない。
This cannot join.
OK。
Just
I
watch
cannot
it.
join.
じゃ
So
あ、ちのさん、
I'll just say,
ヘルプしてあげて、ジェーンさんが。OK.
yeah, I'll just say my ideas. So
OK, good. Thank you.
so the nurse is, because there's already the worried, she feels worried, irritated. I can also say she is unsure, uncomfortable,
right.
feeling uneasy, yeah,
Right.
Okay, feeling easy, right?
uneasy.
Uneasy. Wait.
みんなこっちで書いてるのか。まあ、いいか、こっちでも。はい。OK. So, if you cannot enter, please talk.
Okay.
Somebody will pick up your word.
And
Okay.
we are just only talking for the nurse, not yet for the patient, right?
No. Yes. The perspective of the caregiver or nurse. Yes.
Okay.
What do you think?
He is
Maybe
wondering. He is
because
wondering.
he is wondering.
He
Because
is wondering.
one of the typical BPSD, behavior psychological symptom for dementia is wondering.
Mm-hmm.
If before, he disappeared. So that's why all of the staff look for him. Now one of the staff following him to stop for him to go out.
Yes. He want to see the patient. She want to see the patient.
So by the way, so everybody already write your nickname? 入ってるけど、使えない人がいっぱいいるのかな。まあいいや、it's okay. じゃあ、let's continue this workshop. How the feeling of the nurse or caregiver? Everybody, please, when you write, please say what you write. 加納さん、どうでしょう加納さん。What did you write? Again, this is I want you to use the design thinking. Design thinking is a creative way. If you write silently, you cannot stimulate other people's brain. はい、OK。じゃあ、加納さん、What did you write? Or what do you want to write?
画面が動かないですね。
画面が
動かなくなります。
重いですね。
重くなっちゃったから。
重い。
it's okay. So, 言ってみてください。しろさんが拾いますか、ね。
I will write down.
I wrote the left side, the words together, and the information, and the system, the supporting knowledge, and so on. But
system, system.
System, yes.
System together, information. そう。じゃあちょっと日本語でその意図を説明してもらってもいいですか？ Why you write a system? Why you guess the caregiver thought system?
システムは制度。制度で、福祉用具であるとか、お金にまつわる制度っていうのを、インフォメーションにつながるんですけど、そういったところをこう確認しながら、生活そのものの安心感っていうのは必要かなっていうのは 思ったので書きました。で、やっぱり together は存在っていうか、エグジスタンスっていうか、一緒にいることで安心できるかなっていう。
なるほど、なるほど。はい、わかりました。
あと、存在は、その上で。
エグジスタンスね。
where? 何け
Okay, let me translate. Okay, what he say is that he write one of the word is together. He thought that the caregiver stay with patient together. Maybe patient will be relieved. That's what caregiver thought. I think that is one of the feeling. Anybody? How about Miss Charlie? What did you write? Hi, Miss Charlie, please. Charlie-san, yes, please. あらら。
聞こえない。
聞こえないですね。ミュートオン、please.
Sorry.
It's okay. Hi, go ahead.
The three things I wrote
Which
were
one?
Anxious.
Anxious. Okay, good.
Yeah, those three. Anxious, concerned, and tries to be patient. So yes, the caregiver might be a little bit irritated.
Yes.
But just the same because she's only human, okay? So maybe the patient has been asking that for so many times already.
Yes.
So she gets irritated, but at the same time, I feel that she's still trying to understand and tries to be patient. So she continues answering the question. And yes, I believe that even irritated, the caregiver is still concerned and anxious. Because she does not want the patient to loiter around the compound, so still following, and maybe concerned that the patient might fall, not only get lost but also might fall.
Yes, right.
So I mean, the irritation is still low level compared to the concern. Still high level of concern from the caregiver.
That's why the caregiver repeat the same answer again and again.
Yes,
Yeah. You're right. So what do you think? That she is a good caregiver?
Still yes. Yes. We are not perfect. I mean, nobody is perfect. Nobody is always patient.
Yeah, I see.
But the thing is, if you have the empathy, if you care, if you really care, somehow you will get over that feeling of irritability and impatience.
Yes. Good. Okay, let's move on. The next, please, going down. Next, Mr. Aaron. How did he feel in that morning? How did he feel? Please write it down with sticky note. Okay, I give you the 5 minutes.
どうしようかな。
はい。Go ahead. If you cannot enter but please, you can participate. Please say.
Yeah.
Then,
I will write down.
Mr. Chino, pick up your words.
Okay, can I ask Mr. Kent? Kent-san?
The patient is doubtful of his surroundings.
Pardon?
Doubtful. Doubtful, Sensei.
Doubtful. Okay.
Doubtful ね。Okay, doubtful.
Okay.
Good. Doubtful. Good. What else? あれ、ちょっとちょっとちっちゃいんじゃないそれ。あれ僕が大きいのかな
Yeah.
Okay. Doubtful. Yes. He is doubtful. Of course.
Doubtful. Okay.
Because he cannot recognize anybody in the building.
He doesn't trust anyone in the building.
Doesn't trust, yeah. Because if you are, yeah, doesn't trust. Okay. はい。
じゃあ next、ジョナリンさん。Miss ジョナリン。
Hi, Sensei.
はい。
Sorry, I'm using my cell phone and I cannot access nearby.
Okay.
But based on the scenario earlier, I think that the patient is scared because he don't know where he is. Just imagine you don't know the people calling you by your name and someone is following you.
Yes.
So I think it's very scary and actually sad.
Yeah.
Sad. Okay. Yeah, I think so.
Good, thank you.
Okay, the next is Mr. Jedrick.
Yes, sir. I want to give an emphasis to the caregiver because the caregiver is a flexible person and even creative because she know how to address the her patient because she know how to address the given issue together with her patient because the caregiver is not control or change the behavior of her patient, but also she try to accommodate the behavior of her patient, not to control or to change.
You mean the Mr. Aaron, the field graduate for the caregiver? He appreciate?
Yes, sir.
So what you mean is that the Mr. Aaron feel appreciation to the caregiver because the caregiver.
Yes, sir. Because the caregiver shows her flexibility to
Interesting.
Mr.
Interesting. Okay, good. Thank you. じゃあ、チロさん、今みたいな感じでどんどん当ててください。
はい、OK。じゃあ、Mr. Carl。Mr. Carl? Yeah, please give me your opinion.
Hello and good evening. I think the patient or Mr. Aaron is puzzled and has a lot of questions in his mind since he's experiencing dementia and gradually he's thinking of where he is, who are the persons. He is also puzzled that how can son paid all the bills, his food.
Right,
so he's being puzzled and doubtful situation.
Yes. He's scared to become a criminal.
Yes.
Without paying. Oh, yes. Maybe, yes, he feel like that. Good. Seru-san, you want to say?
Yes. I think Mr. Aaron is anxious because he's wondering where is he now, and he's also worried about the son's.
Yes.
He is very anxious. It means, and at the same time, he wants to be treated as normal as possible. So he's trying to find a way out, how to exit on the place.
Right. Because he is living in his 40s.
Yes.
How come maybe the 10 or 12 years old son pay his bill? Yeah,
So in the true personhood is a person's independent thinking and understanding processes are formed when she or accepts something this course of life. In the situation where he is right now.
Right. You really studied the dementia care expert.
Yes. Yes.
Good. Okay, time's up. Time's up. Okay, let me read first the perspective of caregiver. Let's say. これはなんだ？これなんだ？ Where? Where? Who write this? Where about?
Where about?
Where? Where is he? とか、Where?
It's me.
はい、何ですか？
I wrote. 居場所っていう意味で。
居場所。
スペル間違ったかもしれない。
居場所はだから his own place とかね。はい。Okay, thank you. Irritated or worried or stop patient, maybe. Together, information system. Here. Miss Charlie said anxious, tries to be patient, concerned. Okay, observed. Okay, good. How about from perspective of Mr. Aaron? Doubtful, scared, sad, empathy with caregiver, interesting. Worry about the payment, surprising, worry to become criminal, that's what I write. Hopeless, anxious, yes. Okay, you know, if you practice how to use a miro, I think there are so many sticky notes here, but now many of you is a beginner, don't worry about that. But anyway, my point, why I do the workshop, because I try to understand the feeling of the patient with dementia. Okay. In the caregiver, here, maybe she is irritated or she is concerned. Maybe she wants to stop his wandering. But if she understands how Mr. Aaron feels, maybe her reaction will be different. Am I correct? Because he is living in his 40s. If she, a caregiver, knew how he feels, when Mr. Aaron say, I'm sorry, a problem that I don't have money to pay, then she said, don't worry, Mr. Aaron, his son, Ben, pay. Maybe she will never say that if she understood how he feels. Maybe she say, don't worry, Mr. Aaron. Today, what do you say? Okay, today is a free breakfast. I don't know, free breakfast. Or I cooked a lot of food. I want to share some food with you. Something like this. Am I correct?
If I said, how
do you say?
I try to cook. Could you try to taste?
Very good. Very
so
good.
He doesn't feel the sorry.
Very good. Very good.
He will help me.
Very good. Yes, that is the way. Thank you very much, Mr. Chino Sensei. Okay, so that's why the reaction will be changed, right? Or then Mr. Aaron somehow relieved to eat. At least he doesn't need to worry to become a criminal, right? So that's why we should use our imagination. How patient feel, how patient see or understand what you say. That is a very important. Okay, but both sides is you should study. First, of course, you should understand what is dementia, and also you should understand how the patient feel. Both sides is very, very important. That's why I want to start dementia design care combination. Okay? I think that's all. That's all. Okay, thank you very much, everybody.
Thank you,
Thank
Sensei.
you.
All right, thank you so much, Mr. Jack McCoy, for facilitating the workshop for tonight. And I'm pretty sure that everyone learned a lot about dementia design care.